Hospitals are designed to handle trauma, panic, and life-or-death emergencies. What they are apparently not designed to handle is a fully grown adult filing a formal complaint because the blanket felt emotionally unfriendly. Today, we're diving into 69 of the dumbest, pettiest, and most reality-resistant patient complaints ever aimed at the people trying to keep them alive. MRI machines are designed to scan your insides, not entertain your outside. One furious patient filed a multi-page complaint because the imaging tube didn't have a built-in screen for Netflix while he was inside for 20 minutes. Staff explained that giant medical magnets and flat-screen electronics do not exactly thrive together. He still left angry, insisting a modern hospital should at least provide an iPad mount for his cooking shows and emotional comfort. Hospital gown ties became a full dignity crisis for one man, who complained they felt emotionally flimsy. He argued that the thin little strings at the back created a deeply unstable garment experience that failed to honor the seriousness of his procedure. He didn't want treatment changed. He wanted stronger, more reassuring ties that projected confidence. Apparently, the real emergency was not his condition. It was fabric that lacked leadership energy and a vulnerable moment. A woman called an ambulance for severe foot pain, got rushed to the ER, then magically stood up the second she arrived and walked straight across the street to a shopping mall. Later, she filed a complaint because the stretcher mattress had been too firm and gave her lower back pain on the way to her shoe shopping spree. Emergency medicine had apparently failed to provide premium suspension during what was, in hindsight, a free rideshare with sirens. Monitor lights exist to keep people alive, which did not stop one patient from complaining that the glowing screens in his room were too medically bright. He said the whole thing felt harsh, clinical, and emotionally unsupportive while he was trying to recover in peace. He wanted the nurse to dim the displays so the room would feel more spa-adjacent. The machines were measuring his heart and oxygen. He wanted mood lighting and a little less survival-themed visual aggression. At 2 in the morning, one woman stormed into triage, screaming about a full-blown medical emergency. The emergency turned out to be a mild sunburn from her beach trip. She threw a tantrum because doctors were busy treating victims from a major highway pileup instead of immediately applying aloe to her shoulders. Then she demanded a sick note for a full week off work. Somewhere in the ER, actual trauma quietly lost to after-sun entitlement. A grown man got so offended by the cold touch of a standard metal stethoscope that he ordered the doctor to warm it up in the break room microwave. When told that microwaving metal would very likely turn the clinic into a fire-based learning experience, he became furious. He stormed out in his paper gown, deeply wounded that modern medicine refused to accommodate his temperature preferences. Apparently, his skin was not just sensitive, it was operating under luxury spa expectations. Waiting room clocks have always been unpopular, but one man treated the hospital wall clock like a personal attack. He filed a complaint because it seemed to move suspiciously slowly, dragging out his suffering minute by minute as if the clinic had deliberately installed a timepiece calibrated for despair. He didn't ask to be seen sooner, he wanted the clock investigated. In his mind, the delay wasn't scheduling, it was weaponized chronology in a fluorescent lobby. Hooked up to IV fluids for dehydration, one woman suddenly demanded to see an administrator because the treatment was, in her words, obviously defective. Why? Because the saline bags kept making her use the bathroom every hour. She wanted a refund and accused the hospital of running a scam that forced sick people to burn calories walking to the restroom. The IV was doing exactly what it was supposed to do. Her kidneys just failed to respect the customer service narrative. One patient wanted anesthesia to smell like lavender because the normal hospital vibe felt too clinical for her nervous system. She said if she was going to be sedated, the least they could do was make the experience more aromatic and spa-like. She wasn't questioning the surgery. She just believed being knocked unconscious should come with a more thoughtful scent profile. Apparently going under wasn't the issue. It was going under without a wellness brand attached. A jealous wife filed a formal complaint because the ICU nurse taking care of her husband was simply too attractive. She insisted this woman's beauty was distracting her husband from healing properly and demanded a replacement nurse who was older, plainer, and less visually disruptive to cardiac recovery. Management had to explain that they do not reassign highly trained staff based on how hot someone's spouse thinks they are. Intensive care was not, unfortunately for her, a controlled casting environment.
Viết tầm 60 đến 70 từ thôi. Thought for 9 giây. Đúng rồi. Từ đây mình sẽ xếp lại. Mỗi case tầm 60 đến 70 từ. Gọn hơn, nhanh hơn, punch hơn.
ICU monitors are loud for one extremely important reason. They tell people when you're about to stop being alive. One post-op patient still filed a complaint because the beeping kept ruining his naps. He wanted the nurses to mute the machine for a few hours so he could rest properly. The nurse had to explain that the annoying sound was basically his heart's customer service hotline. Room service is not a recognized branch of cardiac care, but one man, fresh out of open-heart surgery, still buzzed the nurses at 3 a.m., demanding a large double pepperoni pizza. When staff reminded him he was on a strict post-surgery diet, he accused them of intentional starvation and filed a complaint. In his mind, surviving major surgery apparently unlocked premium late-night delivery privileges and extra cheese. Pill color became a spiritual emergency for one man who refused to take his antibiotics because they were the wrong shade of blue. He insisted pastel tones disrupted his aura and demanded a neon green alternative immediately. The pharmacist explained that drug colors are chosen by manufacturers, not interior decorators. He left furious, convinced modern medicine was actively trying to sabotage his chakras with aesthetically uncooperative bacteria treatment. One furious customer demanded a refund because his medication tasted disgusting and was impossible to swallow. The pharmacist opened the box, looked at him, and realized the man had been chewing rectal suppositories for 3 straight days. Instead of feeling embarrassed, he filed a complaint that the packaging lacked a giant warning image of a butt. At that point, the product wasn't mislabeled. Reality had simply outpaced his reading habits. A couple stormed into an obstetrics clinic threatening to sue because the wife was pregnant, even though they had been using birth control pills. After a few questions, the doctor discovered the husband had been taking them every morning instead. They argued nobody had explicitly explained which partner was supposed to swallow the female hormone pills. Modern medicine had not failed. Basic comprehension had simply taken the month off and never called back. One woman called her doctor in a panic, insisting her arthritis medicine was making her bark at the mailman and crave raw meat. After a baffling conversation, the doctor learned she had mixed up her pill organizer and spent 2 weeks taking her golden retriever's joint supplements. She still filed a complaint, claiming the vet should never prescribe pet medication that looks this snackable to humans. Somewhere, a Labrador lost his pain relief to confusion. Hospital gowns are humiliating enough without someone trying to turn them into runway wear. One man refused to proceed with gallbladder surgery until staff provided something more flattering, ideally in a breathable silk blend that better honored his physique. The team explained that surgery requires access, sterility, and speed, not luxury tailoring. He took this badly, as if the true medical neglect was forcing him into a drafty blue backless sheet. Insulin was called a scam by one diabetic patient, who complained it wasn't controlling his blood sugar. The doctor dug a little deeper and learned the man was still eating an entire chocolate cake for breakfast every morning. He genuinely believed insulin should magically neutralize unlimited dessert decisions. When told medicine still works better with basic restraint, he acted shocked. Apparently, he thought the pancreas had been replaced by a licensed bakery defense system. A man returned to his eye doctor furious that his expensive vision drops had somehow made his hearing worse. Asked to demonstrate how he used them, he confidently squirted the drops straight into his ears. He then demanded compensation for the liquid running down his neck and ruining his favorite polo collars. The medication wasn't defective. It had just been introduced to the wrong head department by a man deeply committed to freestyle anatomy. One woman filed a hospital complaint because surgeons refused to let her emotional support ferret into the operating room for her appendix removal. She insisted the tiny animal was essential to her spiritual alignment and accused the staff of discrimination against holistic healing. The surgeon explained that bringing a furry weasel into a sterile surgery was not alternative medicine. It was just an infection with better branding and surprisingly good whiskers.
Vẫn hơi dài. Viết tầm 50 đến 60 từ thôi.
Thought for a couple of seconds.
Đúng. Từ đây, mình sẽ siết xuống 50 đến 60 từ trên case. Nhịp nhanh hơn, gọn hơn, đập thẳng hơn.
ICU monitors beep for one very important reason: to tell staff if you're about to stop being alive. One post-op patient still complained the sound kept ruining his naps and demanded they mute it for a few hours. The nurse had to explain that the annoying noise was not poor hospitality. It was his heart refusing to do quiet luxury. Fresh out of open-heart surgery, one man buzzed the nurses at 3 a.m., demanding a large double pepperoni pizza. When told he was on a strict cardiac diet, he filed a complaint, accusing staff of intentional starvation. In his mind, surviving major surgery apparently unlocked premium late-night delivery rights and extra cheese. One man refused to take his antibiotics because the pills were the wrong shade of blue. He insisted pastel colors disrupted his spiritual aura and demanded a neon green version instead. The pharmacist explained that drug colors are chosen by manufacturers, not chakra consultants. He left convinced modern medicine was sabotaging his healing through bad interior design. A furious customer demanded a refund because his medicine tasted disgusting and was impossible to swallow. The pharmacist checked the box and realized he had been chewing rectal suppositories for 3 days. Instead of feeling embarrassed, he complained the package should have featured a giant warning image of a butt. Reading, apparently, was never part of his treatment plan. A couple threatened to sue because the wife got pregnant despite using birth control pills. After a few questions, the doctor discovered the husband had been taking them every morning instead. They argued nobody clearly explained which partner was supposed to swallow the female hormone pills. Birth control had not failed. Listening had. One woman called her doctor in a panic, claiming her arthritis medicine made her bark at the mailman and crave raw meat. It turned out she had mixed up her pills and spent 2 weeks taking her dog's joint supplements. She still filed a complaint, saying pet medicine should never look this much like human vitamins. One man refused gallbladder surgery until the hospital gave him a more flattering gown, preferably something less drafty and more tailored to his physique. Staff explained they were running an operating room, not a Fashion Week fitting. He took this personally, as if the infected organ was secondary to losing the chance to look expensive in blue paper. A diabetic patient filed a complaint, saying his insulin was a scam because his blood sugar was still sky high. Doctors later learned he was eating an entire chocolate cake for breakfast every morning. He genuinely believed insulin was supposed to erase all consequences. In his version of medicine, the pancreas had apparently been replaced by divine dessert immunity. A man stormed back into the clinic, furious that his expensive eye drops had made his hearing worse. Asked to demonstrate, he confidently squirted the liquid straight into his ears. He then demanded compensation because it kept leaking onto his shirt collar. The medication was fine. The user had just rerouted ophthalmology into audio equipment. One woman filed a formal complaint because surgeons refused to let her emotional support ferret into the operating room during her appendix removal. She insisted the animal was essential to her spiritual alignment. The surgeon explained that bringing a furry little chaos noodle into a sterile surgery was not holistic healing. It was just infection with branding. A worried mother tested her toddler's new thermometer by sticking it in her own mouth, then called the clinic furious because it tasted like plastic and betrayal. The nurse gently explained she had bought a rectal thermometer. The mother screamed that those should be locked behind glass. Somehow the real emergency became her own quality control taste test. One new mother demanded a refund after delivery because her newborn looked too wrinkly and, in her words, unfinished. She asked the nurses if they could place the baby under a heat lamp for a few hours to smooth things out. Maternity staff had to explain that newborns are not pastries and the hospital does not offer aesthetic touch-ups. After an aggressive teeth whitening treatment, one man came back furious because his smile was now too bright and blinding him in the rearview mirror. He demanded the dental clinic pay for custom sunglasses so he could drive safely around his own reflective success. He had begged for the widest option available, then acted betrayed when the dentist delivered. One woman called an ambulance for a paper cut that would not stop bleeding, then later filed a noise complaint because the sirens woke up her neighborhood at 3 a.m. She wanted the city to replace emergency sirens with some kind of silent, glowing courtesy signal. Apparently saving her finger was fine. Saving it loudly was the true injustice. A man reported his therapist for fraud because, after 6 months of sessions, the doctor had done nothing except sit there and ask questions about his feelings. He wanted a refund for what he described as a premium rate conversation with a man holding a notepad. Somewhere, the entire field of therapy was being accused of excessive listening. A teenager with a broken arm filed a complaint because his cast made gaming inconvenient. He demanded the orthopedic surgeon install a tiny hinge at the wrist so he could pop his hand out each night to play shooter games. The doctor explained that casts are for healing bones, not improving kill ratios. He still seems shocked by that business model. An elderly patient recovering from pneumonia complained that the wheels on his IV pole were not smooth enough for him to drift around hospital corners with style. He requested upgraded skateboard wheels so he could glide to the cafeteria properly. The pole was delivering life-saving fluids. He was reviewing it like a disappointing mobility accessory with poor street performance. A furious, expectant mother complained that her ultrasound pictures looked grainy and outdated. She demanded the scan be redone in full color with a warmer, more flattering filter, preferably something sunset adjacent. The technician had to explain that prenatal imaging is not maternity photography for social media. She had come for medical imaging and left upset that her fetus lacked cinematic lighting. One woman insisted her expensive asthma inhaler did absolutely nothing. Asked to demonstrate her technique, she held it 6 inches from her chest and sprayed it like perfume. The doctor had to explain that inhalers work best when the medicine actually enters the lungs. She filed a complaint, saying nobody had clearly told her breathing was a required step. A man slammed his new hearing aids on the audiologist's desk and demanded his old deaf life back. The devices worked too well, he said, because now he could hear his wife chewing toast every morning. He wanted them reprogrammed with a highly specific mute setting for crunchy peanut butter. Modern medicine had restored his hearing. Unfortunately, it also restored breakfast. A guy burst into the ER, clutching a tiny jar with a dead garden spider inside, and demanded the top trauma surgeon perform an autopsy on it. He wanted to know if the spider had been depressed before biting him. When told the hospital only treated humans, he filed a complaint for anti-insect discrimination. Medicine had apparently failed the arthropod community. One patient complained that his MRI sounded like a terrible nightclub with no rhythm. He said the loud clanking and banging felt like a bad techno set and demanded the hospital hire a DJ to improve the experience. He refused to pay full price for what he called medically mandatory bad music. The machine was scanning his brain, not hosting a warehouse party. A discharged patient threw a fit because his mandatory wheelchair ride to the exit was too slow and, in his view, totally lacking in excitement. He complained that the transport nurse refused to pop a wheelie on the way through the sliding doors. He wanted stronger staff who could deliver him to the curb with more theatrical momentum and at least a little flair. After a routine blood draw, one woman demanded the clinic return her blood immediately when they were done testing it. She claimed that losing a few tiny vials was going to deflate her veins and make her arms look wrinkly for summer. She wanted the staff to pump it right back in afterward. Laboratory science had somehow become a temporary fluid rental service. A wildly hungover student demanded a doctor's note for missing his final exam after drinking 14 beers on a Tuesday. When the campus doctor said that self-inflicted stupidity was not a medical emergency, he filed a complaint. He argued that because alcohol is technically poison, his hangover counted as a heroic toxicology event. In his mind, regret had become a recognized diagnosis. One man reported an orthopedic nurse because the cast saw made him giggle in front of his girlfriend. The vibrating blade safely cut through fiberglass without touching skin, but the tickling sensation on his hairy leg completely destroyed his tough guy image. He wanted compensation for emotional damages. The nurse had removed his cast correctly. His masculinity was simply built on disturbingly fragile foundations. A patient stormed out of radiology demanding a new chest image because the X-ray showed his skeleton, which he found deeply creepy and inappropriate. He wanted them to retake the picture and somehow remove the bones so he could just see his lungs. The technician had to explain that his skeleton was not a Halloween effect. It was, unfortunately for him, a permanent internal roommate. One man stepped on a rusty nail and still refused a tetanus shot because he said anything named after a metal violated his organic vegan lifestyle. He demanded the doctor treat the wound with garlic and positive crystal energy instead. When told that was not how bacterial infections work, he filed a complaint. Apparently sepsis was acceptable. Trace medical practicality was not. A furious patient marched back into the clinic, complaining he could not read a single word on his handwritten prescription. The only problem was, the clinic had switched to printed electronic prescriptions 3 years earlier. Staff eventually realized he was waving around a random scrap of paper he found in the parking lot. He had come in angry at medical handwriting and left defeated by litter. One patient on pre-surgery fasting orders buzzed his nurse 6 times in an hour to complain that the ice chips were too cold for his sensitive teeth. He demanded a fresh cup of room temperature ice immediately. The nurse had to explain very carefully that once ice reaches room temperature, it stops being ice and starts being exactly what he wasn't allowed to drink in the first place. A diehard sports fan begged for a bright orange cast to match his favorite team, then came back 2 weeks later demanding it be replaced with black after they got eliminated. He said the current color no longer reflected his emotional reality. The doctor refused to saw off a perfectly good cast over playoff sadness. Orthopedics, it turns out, does not offer grief-based recoloring. One woman filed a complaint after her first physical therapy session because the exercises made her sweat and ruined her expensive salon blowout. She demanded a refund, accusing the clinic of tricking her into unauthorized cardio. The therapist had to explain that rehab for an injured knee does, in fact, involve moving the knee. She had apparently expected recovery with air conditioning and light emotional support only. A bored patient repeatedly buzzed the nurse station because the remote clipped to his pillow was broken. Staff finally discovered he had been pointing the nurse call button out the window, trying to change the channel on a television in a completely different building. He still seemed offended that the device lacked cross-street broadcast authority. The hospital had given him access to help. He had mistaken it for long-range entertainment control. One man begged for the strongest sleep aid available, then filed a complaint 3 days later because it worked too well and made him miss the final 20 minutes of an action movie. He demanded reimbursement for the streaming rental fee, arguing the medication had robbed him of cinematic closure. The doctor had treated insomnia. The patient wanted better timing and perhaps a sleep aid with spoiler protection. A fully grown woman threw a tantrum because the wooden tongue depressor used during her exam tasted like wood instead of strawberries. She later filed a complaint suggesting all throat tools should be dipped in flavored syrup before use. The clinic had to explain that coating diagnostic instruments in sticky sugar would be a medical disaster. She still seemed convinced modern healthcare was being needlessly anti-flavor. One man lost his mind during a routine neurological exam when the doctor tapped his knee and his leg kicked forward. He accused the physician of using dark magic to move his body without written consent and stormed out yelling that his limbs belonged to him. The doctor had demonstrated a normal reflex. The patient had apparently just discovered that his own nervous system had side quests. A patient asked for a larger container for his urine sample because he felt a standard plastic cup was insulting to his masculinity. He said the small size failed to respect what he described as his legendary flow and demanded something closer to a gallon jug. The nurse had to explain that the goal was a sample, not a heroic demonstration. Healthcare had somehow wandered into performance masculinity with a lid. One woman complained her rented crutches were not aerodynamic enough and were slowing her down at the mall. She demanded a free upgrade to something lighter, sleeker, and more performance-oriented, preferably carbon fiber. The crutches were helping her walk on a broken ankle. She wanted medically approved speed equipment. Somewhere between injury and consumer expectation, recovery got mistaken for a sporting goods sponsorship opportunity. A man returned after his appendectomy, furious that the tiny scar was too neat and not nearly dramatic enough to show off at the beach. He wanted the surgeon to go back in and make it look more like a shark attack. The staff refused to mangle healthy tissue for aesthetic credibility. He had survived emergency surgery and somehow still felt cheated out of cooler storytelling opportunities. One patient accused the dentist of false advertising because the laughing gas failed to say anything funny. He sat through the procedure waiting for jokes that never came, then demanded a refund because the anesthesia had completely misunderstood the assignment. The dentist had numbed his fear and pain. The patient had apparently expected a stand-up set with local observational material and maybe crowd work about floss. One woman left her annual checkup furious because her blood pressure came back high, and she blamed the arm cuff for squeezing her too hard and upsetting her emotionally. She demanded a machine that could read vital signs from across the room without touching her. Apparently, modern medicine's greatest failure was not inventing telepathic blood pressure yet. A man refused to read the bottom line of the eye chart and accused the optometrist of playing mind games because the letters did not form real words. He claimed the doctor was trying to humiliate him in front of the receptionist with random alphabet nonsense. The exam was not a literacy test. His ego just couldn't handle font-based reality. A wealthy businessman got lab results showing dangerously high cholesterol and filed a complaint because he believed his blood was simply too rich from eating expensive steak and lobster. He accused the doctor of being jealous of his luxury diet and trying to downgrade him into peasant food. In his mind, bad numbers were not medical. They were class discrimination in laboratory form. One woman ripped off her cardiac monitor pads and demanded compensation because the adhesive peeled tiny circles out of her expensive spray tan. She was furious that the test had left her chest looking polka-dotted and insisted the cardiologist should pay for a salon correction. The machine had monitored her heart. She was mostly worried about her ribcage's current relationship with bronzer. A man attending CPR training refused to practice on the dummy because its fake rubber lips did not taste like peppermint. He filed a complaint saying that if he was expected to pretend save a life, the hospital should at least make the mouth-to-mouth experience more pleasant. Emergency medicine had not failed him. It had simply refused to mint condition the mannequin. One patient complained that the magazines in the waiting room were 3 months old and claimed this had severely damaged his cultural relevance. He wanted the clinic to reimburse him for a celebrity gossip subscription because he missed crucial entertainment news while waiting for a flu shot. Apparently, the greatest threat in the lobby was not illness. It was outdated coverage of someone else's divorce. A man filed a noise complaint because the digital thermometer beeped too sharply when it finished reading his temperature. He demanded the clinic reprogram all equipment to play a smooth jazz chord instead of such a harsh electronic sound. The thermometer had done its tiny job correctly. He just wanted his fever acknowledged with better production value and less municipal parking meter energy. One man demanded the return of his medically removed appendix because he planned to preserve it in a jar and sell it online to weird collectors to offset his hospital bill. When staff explained it had already been disposed of, he threatened to report them for theft of personal property. Emergency surgery had saved him. He was mostly upset about losing a disgusting side hustle opportunity. A patient stormed out of a dental cleaning and accused the hygienist of pushing a conspiracy because she suggested he floss every night. He insisted flossing was fake science, invented by Big String to drain money from honest people, one minty thread at a time. The clinic had recommended basic dental care. He heard organized propaganda from the rope industry. A man getting stitches in the ER later filed a complaint because during the procedure, the cafeteria had run out of vegan chicken nuggets. He argued that surviving a leg wound without access to crispy plant-based comfort food was a violation of his dietary rights and demanded a discount on the medical bill. Apparently, trauma care is incomplete without properly timed fake poultry. A perfectly healthy guy spent 2 hours in the ER waiting room, then exploded over the terrible wait time. When staff finally checked his chart, he calmly admitted he wasn't sick at all. He had just come for the free hospital Wi-Fi to download a huge game update and felt the speed was unacceptable. Somewhere, emergency medicine got downgraded to a bad internet cafe. An older man filed a formal complaint against the ambulance crew because the oxygen mask flattened his carefully waxed handlebar mustache. He demanded premium imported mustache wax as compensation for the emotional and aesthetic damage. The paramedics had improved his breathing. He was mostly concerned that his facial hair no longer looked like it could successfully run a silent film railroad company. One man drank an entire gallon of colonoscopy prep liquid, then complained it did not taste enough like a margarita. He wanted the next batch mixed with tequila and a salted rim, so the cleansing process would feel more festive. The doctor explained that bowel prep is not a happy hour special. He still seemed deeply offended by how little effort medicine puts into cocktail presentation. A woman stepped on the clinic scale, hated the number, and immediately accused the staff of rigging it to make patients feel bad. She said it was clearly defective because it showed 8 pounds more than her bathroom scale at home, which sat on thick carpet and mostly believed in kindness. The machine was accurate. Her preferred scale just practiced emotional support measurements. A comic book fan came out of an MRI furious that the giant magnetic machine had failed to mutate his DNA or give him any superpowers. He said spending 20 minutes inside a futuristic science tunnel without emerging even slightly enhanced felt like false advertising. The hospital had scanned his organs. He had apparently booked the appointment expecting a low-budget origin story and at least one useful side effect. After tearing a shoulder muscle, one man arrived at physical therapy expecting to lie on a couch and discuss childhood feelings. When handed tiny weights and told to actually move his arm, he filed a complaint that this was not real therapy at all. He wanted psychology with insurance coverage, not exercise in gym clothes. Apparently, the word physical in physical therapy felt unnecessarily specific and, frankly, a little rude. One woman filed a city complaint after an ambulance hit a pothole and caused her iced caramel macchiato to spill onto her designer sweatpants. She had called for a minor panic attack, but reviewed the ride like a furious passenger raiding a rideshare. The paramedics had transported her safely. She was mainly upset the suspension failed to protect a beverage with enough syrup to legally count as emotional support. A patient reported his surgeon to the ethics committee for being a show-off because he used too many complicated medical words while explaining the procedure. The man said hearing proper anatomical terms made him feel intellectually inferior and demanded all future doctors use only vocabulary found in a third-grade spelling book. Apparently, the real malpractice was sounding educated in front of someone who took Latin personally. After surviving a life-saving heart transplant, one man filed a complaint because he suddenly felt an uncontrollable urge to listen to country music, which he had always hated before. He demanded the transplant team find him a new heart from someone with better taste, ideally heavy metal. The hospital had performed a medical miracle. He was mostly upset his new organ had, in his opinion, arrived with suspicious playlist settings. If you had the legal power to ban one of these people from ever filing another medical complaint again, who gets it instantly? Drop the number in the comments, hit like if this raised your blood pressure for fun, and subscribe before someone demands a refund.